I believe that this will emerge as the drug of choice for frontline therapy of patients with progressive, metastatic, radioiodine-refractory differentiated thyroid cancer. All of those criteria need to be met: radioiodine-refractory and progressive disease. At the present time, this would not be an appropriate treatment for somebody who's stable and asymptomatic. But how we use this drug in combination with others may change that paradigm in the future. So on the one hand of the spectrum, we have a progressively decreasing level of intensity of treatment for patients with low-risk thyroid cancer. But for these folks with advanced and metastatic disease that's progressing despite thyroid hormone suppression treatment, we historically didn't have effective options. These class of drugs have created the first really effective potentials. In this phase 3 study, for the first time, we not only saw this marked improvement in progression-free survival, we saw about a 65% response rate, which was unprecedented in the phase 3 studies done in this disease. And most exciting, a nearly 2%, so a very small number, but there were patients who had complete response. And that's the first time we've seen that with any drug in this population of patients, and represents a very exciting opportunity for us to build on this in thinking moving forward. How do we combine lenvatinib with other approaches to therapy to try to bring cure to this group of patients and not just slowing down the disease? So in angiogenesis, the process by which the body, in this case the tumor, develops new blood vessels, the tumor cells send out a variety of signals to the surrounding environment to stimulate the growth of blood vessels that'll be necessary to feed the tumor. The first generation, the drugs like sorafenib, targeted one specific receptor in that approach, the vascular endothelial growth factor receptor. What lenvatinib has as an advantage is not only that it's very potent in targeting that receptor, but also another class of receptors called fibroblast growth factor receptors. And we think that that second group of receptors is not only important in escaping from blockade for the first one, but also directly on the tumor cells themselves, stimulating tumor growth. So lenvatinib to us represented a very potent agent to consider for treating this group of patients. I think we are really seeing the culmination of about 10 years of concerted effort to change the paradigm for how patients with thyroid cancer are treated. And we now have a drug available that in most patients will be highly effective, and it's a push going forward to do even better.